Hi, I'm Dr. Evan Anton, and for today's video I wanted to touch on something that's probably the most sensitive topic in veterinary medicine, and that's euthanasia. I get a lot of comments and questions regarding it, and people say things like, oh, I could never do that to a pet, or I could never do that as a vet, or I don't know, how do you do that? And so I just wanted to talk about some of those things because I totally get it. Before I was a veterinarian, that was really tough for me to grasp as well as a concept. And to start with, I just want to say I fully believe in it. I think it's a really valuable, special thing. Euthanasia is something that separates veterinarians from human doctors in most parts of the world as it being an option for patients and for pets. Now, as a pet owner, you have to ask yourself eventually, when is it time to euthanize if it becomes a time? Some pets do pass from tragic deaths, but many pets, the end of their life comes by means of euthanasia. And so you need to know, when is it time? And unfortunately, this is a very subjective topic. It's not always straightforward. And so a lot of things kind of come into play. One of the big things being overall quality of life. Is your pet enjoying its day? Is it getting more benefit, more positivity out of the day than the negative things that are going on with whatever is occurring in your pet's health? Whether it be chronic metabolic disease like liver or kidney disease, or really bad arthritis, or cancer, or heart disease, what have you. We need to kind of weigh out the pros and cons and decide, okay, this is what they're dealing with, but this is the joys they're getting, and where does that kind of stand, and when do we need to make this decision? Another thing to consider is, with whatever's going on with your pet, is it treatable? Is there really a curative option? And when curing the pet, when treating it, does that lead to a quality of life after everything? So if your pet has some gnarly infection, and it's going to be an intensive treatment for, say, some pneumonia or something involving some hospitalization and serious treatment and time to get your pet better, there's a chance they could actually enjoy life after that. Whereas if it's more of a terminal disease, that's a whole nother story. That's a whole nother approach to this topic of euthanasia. When I regard terminal disease in pets, I not only think about quality of life, I also take in consideration quality of death, okay? And what I mean by that is, we know whatever's going on in your pet, this is going to be the end. This is going to get them in the end. And how much suffering is necessary before we get to that point where we can say, you know what, enough is enough, things are going downhill, they're only getting worse, it's time to make that decision for them. It's time to end the suffering, if that makes sense. So I see this in many kind of disease processes. Cancer is a big one. If we've got terminal cancer, it's only getting worse. You need to realize that for your pet. You need to understand that and realize that they're going to keep declining the longer we wait. And so if they're already suffering, there's no reason to continue the suffering. There's no reason to prolong it. And maybe now is the best time to consider humane euthanasia and just send them to a better place. Make things easier on them, make them more comfortable. This also leads into another really important point for pets as opposed to people, okay? Pets are all about living in the moment. That's something I love about pets. That's something I really just cherish about my pets. Every time I come home, they're excited to see me. They're happy right now. And that's how they are day to day. It's all about the in the moment, day to day quality of life for them, okay? It's not so much of thinking in terms of the future as we often do in people when we're trying to get them through really gnarly disease or terminal disease or what have you. So if your pet is day to day not enjoying themselves, they're not greeting you anymore, they're not really eating, they're losing bodily function, these are all things to start considering, like, yeah, maybe things are looking pretty bad, and my kiddo was not really getting as much out of life as he once was, and it's only getting worse. So that's really important. That's a big thing. Again, quality of life. And then, of course, quality of death. We want them not to suffer as much as possible, if that makes sense. If you're concerned that your pet might be older and might be suffering, and you might need to just start thinking about this concept of euthanasia, I urge you to contact your regular vet or your local vet and consult with them and discuss, what is going on. Do we have a diagnosis? Do we know where things are going? Do we have an idea? What is the quality of life of your pet? And when is it time? And if and when you do decide it is time and it's something you want to move forward with and think would be the best interest for your pet, usually involves a visit going to the vet hospital. A lot of times these guys get a little sedative, and what most vets do, and every vet does it a little differently, but mostly they'll put in what's called an intravenous catheter or IV catheter, and that's just so we have access to the veins. So when we give the final solution, it's a very quick process. So backing up, the final solution is usually a barbiturate. It's usually a drug that was actually previously used in anesthesia. That's just it shuts the mind off before anything. They're rendered unconscious basically, and then it stops the heart. It's an overdose of this drug, and this drug was actually previously used in anesthesia. We just have better, higher tech drugs now available for when we're actually doing anesthesia that are less risky for patients arresting. But when it comes to euthanasia, this medication is perfect. Again, the first thing, they shut off mentally, and then it stops the lungs and the heart. And that's the most peaceful, painless way, truly, that I know to pass. So I think, again, it's a very special, wonderful thing that we have for pets, albeit emotionally really, really rough for everyone. I really hope that this video is helpful for you. If any of you out there that are considering euthanasia for your pet, and I just want you to know it's really a wonderful thing. It's a way to end suffering, and the truth is, when we do this, when it's warranted with pets, in my opinion, they can be eternally grateful for what you've done for them. They can forever thank you for ending their suffering, and they'll be in a much better place. And I promise you it's for the best. And it's going to not seem that way at first, but time will prove to you that this was the best thing. This was in your pet's best interest. And, we're just lucky, really lucky as veterinarians that we have that option. Again, I hope this helps. My condolences to anybody that's lost pets or losing a pet. This week, unfortunately, my little brother lost his cat. We actually grew up with this cat, Gus. He was about 16 years old, and he was suffering from kidney failure, and he had some other neurologic disturbances going on. And so, things were going downhill, and, the best decision was made for Gus. And I can comfortably say Gus is in a much better place now. Thank you so much for watching. I know this is a gnarly topic. It's not fun, but it is a part of life, and it is a part of having pets. You guys take care.